Hello and welcome back to Cannabis Patient Reviews. My name is Alex Fraser. It's been a while since I've uploaded a video to the channel. The main reason for that being that I had a few technical issues, and once I'd resolved those with YouTube, the government had actually made yet another announcement, so the content that in the past video was immediately out of date. So it's very exciting news. 4 days ago, the government decided they're going to reschedule cannabis-derived medicinal products. It's a huge step forward. It's the first time the UK government have listened to the advice of the ACMD on changing laws around illegal substances. So it's a huge step forward, especially under Conservative government and someone like Theresa May, who's always been staunchly anti-drug reform. So there are a few interesting caveats in the legislation that's been put forward. The main one being that they've decided to reschedule cannabis-derived products. That's the term that they're using. As yet, what actually is what counts and what constitutes as a cannabis-derived product is not been defined. So it's up to the ACMD and also the DHSC, which is the Department of Health and Social Care, and the MHRA, not the ACMD. The DHSC and the MHRA have been set the task of defining what exactly is a cannabis-derived medicinal product. So once we find that out, once they've decided on that, then those products will be moved into Schedule 2. What this means is that raw raw illicitly grown cannabis still remains as a Schedule 1. The worry there is that, of course, products or drugs that are in Schedule 1 cannot be researched. In fact, the ACMD did bring this up in their recommendations. They basically said that Schedule 1 acts as a barrier to research and that they would move towards... they said that they would be working towards changing that. So that's an interesting little... side note in the ACMD. The government haven't taken that on in any of the legislation that they've changed, but I think that what we could be looking at is a sort of re-evaluation of what Schedule 1 means that might loosen up the ability to research some of the drugs in that scheduling, which is very interesting and has lots of implications for the use of MDMA, which we've seen in therapies being studied in the USA, as well as psilocybin from magic mushrooms and also LSD as well, which have shown promise in various different medical fields, mostly in the field of mental health, depression, PTSD and those sort of things. What exactly will this mean in terms of cannabis-derived medicinal products? We think that it will be... one of the main things that we really have to address is whether or not that will include herbal medications. It's interesting, and I've been speaking to a lot of patients in the UPA discussion forum about whether or not herbal medication is a necessity and why that is. And some people have talked about the entourage effect, and the question then becomes: is the entourage effect a combination of all the chemicals in the plant, or is it a combination of all the chemicals in the trichomes on the plant? In which case, you can still get the entourage effect from extracts. So there's a lot to think about, and we definitely need to be thinking about presenting some advice to these regulatory authorities for when they come to defining exactly what a cannabis-derived product is. And I think it's very important that patients be talking about what different types of consumption methods they use, and what types of cannabis that they're actually consuming, whether that's oils, hashes, herbal medications, these sort of things. There are pre-existing herbal formulas that would be available on prescription in other countries, that are available on prescription in other countries and could be available here from companies such as Bedrocan in the Netherlands and Tilray in Holland. They both have pharmaceutical grade herbal medications. So one of the really difficult things at this point is, firstly, that we don't have any sort of system in the UK for medications that don't have more than one active ingredient. All of our medications that we have on prescription, they have one active ingredient. It's isolated out and added into a formula so that it can be dosed and then available on prescription. So how do we do that with cannabis when we know that THC and CBD work in synergy, and that you need a bit of CBD to counteract some of the effects of THC, and also you need THC to sometimes help CBD work when it's mitigating seizures in epilepsy patients? I think there is some evidence for that as well. Although I can't bring the studies up immediately to mind, but so there's lots of interesting things to think about there. The other element that we really have to think about is the criminalisation of patients. None of this legislation involves any decriminalisation, and patients will still be criminalised for possessing anything illicit, for possessing and consuming cannabis that isn't in the formulation of a prescribed medicine, and also for growing their own as well. And I think this is an absolute travesty. I mean, when the government has now said, we admit that there are medicinal uses to cannabis, and we're going to rethink about putting some of those products out there, I think the very least that they could do is put in place a decriminalisation that will enable patients to go about medicating freely in the meantime while this legislation is being worked out. Although they've said it will happen as soon as autumn, there will be patients that need to consume cannabis before then. And after them as well. I do think that there are going to be situations where there are patients who, for example, might not have a diagnosis yet, or who might not tick the criteria that is put in place for accessing these medicines, and who will be using illicit substances in the meantime. And I think it is absolutely imperative that we decriminalise at least the possession and consumption of all forms of cannabis, so that patients aren't caught up in the criminal justice system and don't end up spending time in a cell, which, you know, obviously just isn't going to be conducive to somebody with a chronic condition. So the other thing that a lot of people are very concerned about is the fact that it's Schedule 2, which is being recommended, rather than, for example, Schedule 4I, which is where Sativex is scheduled. This is a bit of hypocrisy. We're talking about cannabis-derived products. Sativex is, without a doubt, a cannabis-derived product. No matter how the government or these health authorities decide to define a cannabis-derived product, Sativex is almost certainly going to fall into that definition. So it's a bit of a hypocrisy that would remain in Schedule 4I, whilst other cannabis-derived products are in Schedule 2. However, in practical terms, this doesn't really make a massive difference to patients accessing on prescription. Doctors are quite happy to prescribe Schedule 2 drugs when they feel there's a need for them. In fact, it's not the scheduling of cannabis that's going to be the main hurdle for doctors prescribing. The real hurdle is the fact that doctors don't fully understand cannabis and aren't educated about the endocannabinoid system. And this is something that we must absolutely counter as soon as possible. Now, working with the United Patients Alliance, I know that in the background, although we've not made a huge announcements about this yet, we are planning everything that we can do to make sure that doctors, physicians, pharmacists, anyone prescribing or dispensing these medications is as educated as possible as soon as possible. So that is, I mean, you know, a doctor's not going to prescribe something when they don't understand it, when they believe in some of the misinformation out there in terms of its negative effects. And we need to get the real information in their hands as soon as possible, and we need to be educating and training these health professionals as well in how to deal with cannabis medications, when to prescribe them, what types to prescribe, what formulations, what cannabinoid ratios, and what symptoms and what illnesses need them, and how that works. It's a complicated subject. I think a lot of people underestimate how much there might be for doctors to learn. But that is something that we are expediting and we are moving forward with. And it's something that, as a blogger here on Cannabis Patient Reviews, I'll definitely be trying to do my bit. And what I would like to do is to talk to individual patients and have some conversations with them about how they medicate, so that doctors can better understand what they're going through. So, and the different methods of consumption and other things as well. But we really should be very happy with this as I move forward. It's going to enable thousands and thousands of chronically and mentally unwell people in the UK to access cannabis-based medicines to relieve their symptoms. And a lot of these medicines will be very effective. I think people are concerned about what's available out there. And I would say go and do some research. There are some great products available. We've already talked about Bedrocan and Tilray. There is also Columbia Care, who are from New York State, who we had a great meeting with the United Patients Alliance, and other people were involved in that meeting on Monday last week, which was very much involved in beginning the informing of health professionals and legislators about how cannabis works. So we had Dr. Rosemary Mazanet from Columbia Care come and talk about how things work there and how their system works in New York State, and the pros and cons of that, which was very interesting. The other things that we really should be happy about and we should be thinking about is the fact that actually there is a lot of reasons why having prescribed medicines and specifically regulated pharmaceutical grade medicines is really important. A lot of people will be very upset that they will only be able to get prescribed versions and not be able to access, for example, the strains that they were growing themselves in a legal sense. Hopefully a decriminalisation will enable people to continue to self-medicate, but that is something that doesn't seem to be moving forward at this time. So why are pharmaceuticals so important? Well, supply is the main reason. If you go to, even if you're in a legal state in the USA, and for example, let's say OG Kush is the only strain that really helps you get to sleep and you've got insomnia, you go to your dispensary. What if they've run out of that particular strain? What do? For many people and many symptoms, it's easy enough to find another strain that will do similar things. So, but for some people with certain conditions, you're going to need that exact ratio of cannabinoids every single time you medicate. And the only real way to ensure this is with pharmaceutical grade products. The other thing is contaminants. And there's a lot of lab reports coming back from legal states in the USA, from states that have medical access, where the products that they're producing in the dispensaries are contaminated with heavy metals, molds, funguses, and other things as well, pesticides and other things. So having a pharmaceutical grade product ensures that every single batch is tested and that the products are of the highest quality, and that is absolutely essential. Some people might be happy consuming illicitly grown cannabis, but for someone with a really serious chronic illness, consuming mold is going to be incredibly dangerous. Consuming some of these chemicals might have a massive negative effect on your immune system, might cause a flare that can cause some serious long-term damage. So making sure that we have the safest possible products for those who are really seriously ill is absolutely essential, and making sure they're always accessible via the pharmacy, as all other medications are, is also really important too, and we really mustn't forget how important that is. And how essential that is to those who are really chronically ill. Yeah, it's a mixed bag really. There's a lot of positives to come out of this change, and obviously at the same time it's a very small incremental move forward in terms of the wider reform movement. It's sort of the thing exactly what activists like myself were expecting, and it will absolutely help thousands and thousands of people. It'll also save them a lot of money if you're purchasing cannabis illegally as well. It's going to save you thousands and thousands of pounds every year to be able to get your medication, in some cases free on prescription. So yeah, I've waffled enough. I think you understand what's going on here. There's a lot of positives. If you have any questions about anything that I've said or the legislation or what's being put forward, do ask in the comments. Obviously, as things are presented, as the legislators start to define what this means, what a cannabis-derived product is, and what this legislation looks like, I will be updating you guys further. In the meantime, of course, though, please share this video with everyone you know, please spread it around, and please subscribe as well, and stay tuned. We're going to have lots more videos coming your way very, very soon. This has been Alex from Cannabis Patient Reviews. Thanks. See you soon.